Wilms tumor. A Wilms tumor is most common kidney cancer in children. Most children with it have a tumor on one kidney. Wilms tumor symptoms are abdominal pain, abdominal swelling, fever, nausea, and lack of appetite, high blood pressure, constipation. Also, we see blood in the pee, shortness of breath. Then, causes of Wilms tumor are all cancers happen when cells in your body start to grow out of control. If uh, the most of the time this is because of random change in gene, or rarely it's because of gene change handed down for a parent. The risk factors are more common age. Most children who get this type of cancer are between the 3 to 5 year old. Genders, girls are more common than the boys. Race, black children are slightly more likely to get a Wilms tumor. And family history, if someone in your family has had a Wilms tumor, the odd or higher that your child will get it. Birth defect, that testicle that haven't dropped, that is known as cryptorchidism. The opening of the penis is on the underside instead on the tip, that is hypospadiasis. A total or partial lack of a colored area of the eye, that is aniridia, or hemihypertrophy. Another health conditions like Evelyn's tumor sometimes happen in children who have other rare conditions like Weger syndrome. In that there is a problem in urinary tract. Microcephaly is when baby is born with a unusually small head. Back with Widman syndrome causes internal organs that are larger than usual. There are types of Wilms tumor. There are two kinds of Wilms tumor divided by how to cell looks under microscope. First one is favorable histo. In that, uh, there is children with this type have a good chance of being cured, and unfavorable or anaplastic histology. This type have variety of deformed cancer cell. It can be much harder to cure. How to diagnose? Physical examination, medical history, blood test to check how well your child kidneys and liver are working. We sent a blood test like CBC, LFT, KFT. A urine test to look for blood. Imaging test like ultrasound, MRI, CT scan for abdominal. If if doctor find a tumor in your child kidney, then they take a small sample to look at under microscope or biopsy. Then order more imaging tests to find out whether the disease has spread, or do a bone scan to look for disease bone. There are staging in Wilms tumor also. Stage 1, it is only one kidney and surgery can remove it, and second cancer have moved into the area around the kidney. Stage 3, cancer hasn't spread outside the child's abdomen. Stage 4, cancer is spread to part of body that are farther away like lung, bone, brain, lymph node outside the abdomen. Then in stage 5, there are tumors in the both kidney. How to treat? We can treat by we can give surgery, chemotherapy, or radiation therapy. For surgery, we do partial nephrectomy or radical nephrectomy, or removal of the both the kidney. Then if we give the chemotherapy to the patient, then there is side effects for that, like hair loss, fatigue, mouth sore, loss of appetite, diarrhea, nausea, vomiting, then higher chance of infection. So that's all about Wilms tumor.